So this is a continuation, and as we go through treatment, he keeps recalling certain traumas that he's had, and mentions a clubfoot when he was, at birth. And although I would never know by looking at it, but it's interesting how his history evolves as we start treating him. And he had a distinct asymmetry left and right with his pelvis, and he no longer has that. So, point being that we have people out there, and we have clinicians who say, oh, your sacroiliac needs to be adjusted because your pelvis is asymmetrical. And that's a very limited perspective. And then they're, believing that if someone adjusts the pelvis and then we stabilize it, either with muscles or with hardware, then that'll fix everything. And sometimes it simply is driven biomechanically from other joints or reflexively driven. And what I'd like to do is keep filming. We're not going to capture your face, but I'd like you to walk around just real briefly, and I'm just interested in your spontaneous comments.
Walk.
Sure.
I just feel much more stable on the left-hand side.
Okay.
Much more stable on the left-hand side. I feel like I can come over my left foot.
Okay.
I feel like I roll in. Yeah, okay, so I feel like I roll in and my left pelvis can roll into anterior as I flex. I can come over my left ankle, left hip, and there's almost a driving of the left foot and ankle and hip through to be able to swing the right leg through much easier. So that the momentum coming over the left side enables me to flex right hip.
Nice, and you had a lot of trouble flexing hip some time ago, correct?
Yeah.
That was a big piece of your presentation.
So there's the momentum of coming over the left side is making the right side much easier.
Yeah. I look forward to testing you in sitting, because you could have a subtle leg length difference. You could have a little asymmetry of the pelvis that I'm not able to pick up, but sometimes in sitting it's a lot more apparent. And I know that one of the primary things is coccygeal pain that brings you here, so we need to pay attention to that. But it could be that it was being loaded asymmetrically from asymmetry in the pelvis, hip, even the talus. In sitting, it's going to alter your leg length. It'll create a kind of a false leg length difference even in sitting.
My belief is that because I wasn't getting that motion at the ankle, I was getting it at the hip, and I think obviously maybe that sacrotuberous ligament was pulling on the coccyx as the hip rotated excessively to gain, because I couldn't roll off the ankle. I think I was probably trying to roll in the hip more,
Right.
and then that's pulling this maybe the coccyx, and because of the fusion, maybe the sacrum didn't have as much mobility to come with it. I don't know.
Yeah. Well, before we stop filming, let's just look at the sacrotuberous ligament.
Cool.
If you would lie on your stomach. So, we could do all kinds of soft tissue techniques to that sacrotuberous ligament that would not, in my opinion, create a lasting change. What we need to do is find out why it's so tight and deal with the cause. And there is your sacrotuberous ligament, and I'm springing it repeatedly, and I let it bounce back, and now I let go, and there's a final little spring of the soft tissues. So that's a different, this structure is behaving very differently now. So we'll stop filming. Thank you very much.